bloodstream and her organs. They used every antibiotic that was available in the United States at the time, a total of 26. The infection thrived. The woman died of septic shock 2 weeks after arriving at the hospital in Reno. Meanwhile, doctors on the other side of the world were facing an unprecedented challenge as well. Karachi, the largest city in my home country of Pakistan, could not be more different from Washoe County. It's a port city, a sprawling urban metropolis of nearly 15 million people, and among the most densely populated parts of the world. In the fall of 2016, a typhoid outbreak in and around Karachi was proving extraordinarily difficult to control. The typhoid was resistant to most frontline drugs. It was caused by another member of the Enterobacteriaceae family that the doctors encountered in Nevada, Salmonella typhi. The outbreak that started in 2016 would last for nearly 4 years and affect thousands of not just people in Pakistan, but people who traveled to and from the country as well. For Karachi citizens, this outbreak of a resistant bug was unprecedented. Typhoid is not uncommon in Pakistan, but a number of readily available antibiotics were proving no longer effective. Ultimately, there were only 2 left, carbapenems and azithromycin. Carbapenems are expensive, must be given intravenously, and require hospitalization, something many Pakistanis living in Karachi cannot afford. For them, their lifeline depended on the efficacy of the other option, azithromycin. Doctors and public health experts worried about the day when that option would no longer work. Their fear is not unfounded. Bacteria mutate quickly and can also acquire resistance from other members of their family. What if the next outbreak is resistant to azithromycin as well? And what happens if that outbreak spreads, not just across a city as large as Karachi, but throughout the country or around the globe? The Pakistan outbreak was classified as XDR, extensively drug-resistant, the worst-case scenario. Worried about the threat, the CDC issued a warning for people traveling to Pakistan. Still, at least 6 people who had recently traveled to Pakistan during the outbreak came back to the United States and were diagnosed with XDR typhoid. Canada and the United Kingdom also saw patients with XDR typhoid. All had traveled to Pakistan. Drugs available in Canada and the United States proved effective, and all of them survived. But many in Pakistan did not. Patients across age groups, geographies, and economies are connected in this web of untreatable infections. It is not just a problem of resources or poverty, as some of the most advanced healthcare systems in the world are struggling to manage drug-resistant infections. In the United States alone, well over 35,000 people die every year due to multi-drug-resistant infections, some of them in highly reputable hospitals. More people around the world die due to drug-resistant infections than breast cancer or HIV/AIDS or complications due to diabetes. While cancer and HIV/AIDS deaths are declining in the United States and in many parts of the world, deaths due to drug resistance are constantly, rapidly increasing. Connected across continents, countries, and cultures, antibiotic resistance is a danger to all of us. James Johnson, a prominent infectious disease specialist and expert in antimicrobial resistance in the United States, put it well when a journalist asked him how close we were to falling off the cliff into a world where our antibiotics no longer work. His response was simple: we are already off the cliff. Similar warnings and declarations have been made before, and yet somehow, through discoveries during war and in times of peace, through genius and serendipity, in pursuit of profits, and in demonstrations of compassion, scientists have been able to delay a total apocalypse. But is this time different? Are we near the end of our luck in the battle of people and pathogens? How much time do we have left? Chapter 1. What we're up against. Bacteria have been around far longer than humans, about 3.5 billion years longer, and they also outnumber us by a lot. There are more bacteria on Earth than there are stars in the universe, and there are about 40 trillion.